All right, so thank you, Amy Cooperman, for joining me. I'm really excited to have a conversation with you because we've had some back and forth, and I think you've been using some of this work with your people. Really excited to hear about that as well. Welcome, Amy.
Thank you so much for having me, Sue.
Yeah. So let's start first getting to know you and how you got into occupational therapy. And maybe you could define what that is for people who don't know.
Okay, fine. So the word occupation is confusing for people because they think it means like a vocation or an employment type job, but what it really means is the job of living. So we look at occupations as wherever a person is in their life. It could be babies, children, adolescents, adults, older adults, and whatever physical situation they're in, what are the quote jobs that they're having problems with in their life. So we basically are interested in every single thing to the minutest detail of what people have to do as human beings. So that means that it's a very broad and deep field. We're trained in physical rehab, a lot of psychiatry, neuro. I mean, you name it. Like we have a very extensive training, and then OTs choose their work settings. Like there's all different kinds. I came into it from I was in my 30s, and my experience was really with art and psychology, like art therapy. I was very interested in how people look at things, how they perceive the world. So that was always my focus. So when I went into OT, a friend was encouraging me, and she said, "You're too creative for nursing or dental hygiene. OT, you'll be able to use those creative skills."
Oh, that's great.
And she was right. Yeah, I've been really able to do that.
Are
So
you a visual artist?
yeah.
Yeah. So painting, drawing.
Um, yeah, calligraphy, brush,
Oh,
some
nice.
sculpture.
Oh, nice.
Yeah,
Oh,
yeah.
wonderful. Wonderful. Um, that's great. And so you focus now, you're working with fall prevention, or do you do do you have other focuses as well? Are you using your art therapy in the clinic at all?
I do. It's interesting how the the creative mind actually switches things around. Like I used to play a lot with found objects and different kinds of materials, saying, "Oh, I could use this for this and this for this." And now it's changed because the doctor who's it's his clinic, he's a genius of a person and very creative in his intellect. So when he will give me an idea for something, then it starts the juices flowing. Oh, we could use this intervention for this and this for this. And then I made like my artwork. So
That's
the
great.
interventions have become a form of art for me.
Yeah, that's great. I think, what I see is like anyone who gets to a certain level of passion and precision and expertise in their area seem to have they are pulling creatively from inspiration. They are working creatively just because that's how you excel at what you do.
Exactly. It's a lot of intuition. But what's wonderful about working with a doctor in this field is that you get all the research part, like the part that I was missing, a lot of
Mhm.
the kind of the backbone, like, is it evidence based? And how
Mhm.
many inches and the measurements and being precise with that, but also having the flexibility to make it art and to make it dance and to make it exciting for people. So it's a wonderful combination.
Yeah, that's so great. Yeah, because when you have the precision of the constraints, like the measurements, for instance, then you can really kind of progress something forward. If you just have
Mm-hmm.
like unending creative formations without any sort of constraint, it just kind of can go kind of nowhere or kind of dissipates.
Exactly.
Yeah,
exactly.
yeah. So that's fantastic. You reached out to me, or maybe it was one of your feedbacks. You said that you use this work with the work from my book, When Things Stick, Untangling Your Body from Old Patterns. You use that with your clients. Can you describe how you use that?
Sure. Um, I saw, let's see, I saw your book when I think it might have first come out, and I was watching the videos, and um, it like really rang a bell for me, because we work with mostly elderly, but it could be people in their 40s, 30s, maybe, with very complex histories and movement patterns. And since we're looking at fall prevention, it's a lot of balance and gait and trying to figure things out. And the way I look at things, I like to take a whole picture of the person, like inside and out, the neurological, and we do look at every single thing, but especially when just analyzing people's movements, I saw so much was not, we weren't addressing. Like, as holistic as we are, I felt that we were missing things. Like, we talk about core strength, or like I'll do Tai Chi, and I do different types of patterns. But then when I saw your work, like especially the work with the pelvis and that infinity sign, it was absolutely brilliant. Like, we've had people with like one patient she had hip surgery many years ago. She's in her 70s, and one hip was locked. So she had been like hobbling along with a walker. And then we started doing the infinity pattern. I had her draw it on the dry erase board with the eyes open and closed. And then I had her draw it with both hands and move in the same pattern. And she got so much from that, so that she takes that with her when she moves. She's starting to move with the pattern. Now we're
Yeah,
kind of
that's so
integrating
cool.
it. It's
Yeah.
very cool. And the idea of fascia, like, I'm only first studying it now. It's amazing how little I ever learned about it. But your concept of the stretch by the wall was a very deep experience for me, just standing by the wall, having the comfort of the wall and doing that stretch. It was very, very powerful. So I've taught that to people who have um all kinds of, like, they're tight. Most of the people we see are very, very tight. Their hamstrings are like frozen, and their posture is very poor, and they're afraid to fall. They have fallen. They have spinal fusions. I mean, you name it, they come in with lots and lots of history. But these stretches, they kind of, like, I have to modify them sometimes, but they work. Like, I just did it by the wall with a patient the other day. Um, Very tight, almost looks like she has Parkinson's, but she doesn't. And she has the beginning of the plantar fasciitis. So we did that one next to the wall, and she said her feet felt so much better. And
Mm.
I don't really think there was a way to unlock those feet. Yeah, I
Mm.
can't, there's only so much you can do. Like, we use a vibration board and all kinds of interesting things we use, but those stretches, those targeted stretches, they're gold. I really think they're golden
So
tools.
when you're saying targeted stretches, which ones are you talking about the three keys or
The
how
three
about the
keys
three?
is something that I educate people on,
Mhm.
so that they're paying attention. Like the hips, um, most people are not using their hips when they walk. It's just a very stiff, um, mechanical, no rotation, that kind of thing. So the hips have gone by the wayside. So the understanding of the skull, the position of the head, the hips, the shin ankles, feeling it, the proprioception, that's the pieces that I think are so important. Especially, we have patients with neuropathy, many patients with neuropathy, and we do a lot of treatments for them, which seem to be helpful, very helpful. But that grounding those feet into the floor with the shin ankles and feeling it, and eyes open, eyes closed, those things have been fantastic.
Great. That's great. Yeah,
Yeah,
that's
yeah.
wonderful. What about in your own body? Have you been using that for yourself?
I do. I really, whatever I use on my patients, I use on myself, and I really do see the difference. Um, it's it's very deep, that these um the blockages, where they come from, where, like, it's in there. It's in there. The trauma, I mean, the trauma, all our experiences is locked up in there. And I think with those three keys, like, you really can, you can go as deep as you want, I think, into that healing process. But even if you just stay with just the biomechanical, it's still very powerful.
Yeah, yeah,
Um,
exactly. Yeah.
yeah. And
But
I think the way you explain things is also, um, it's very healing, and it's doable. It's doable. Yeah.
yeah, yeah, yeah. For me, it's always goes back to that. That's kind of my North Star. Like, can people do it in a way that gives them results? And
Yes.
yeah.
Oh, there was one more thing, that we work a lot on sit to stand,
Oh, great.
because it's very important. It's actually one of the tests we use for driving skill,
Hmm.
because you have to be able to, like, get up out of a car. If the car's on fire, like, you have to get out of there, or whatever it is, get in and out without holding on. So we work on that, we time it. And a lot of the people were getting up in such a way, like, it was not helpful just to, like, push down on your lower body and just jerk yourself up. So I was showing them how to, that concept of elongation,
Hmm.
like elongating the core and coming up like Superman.
Hmm.
And that made a huge difference for them. People are popping up out of their chair.
Oh, that's so exciting.
Yeah.
Yeah,
Yeah.
that's
So all
beautiful.
the tools are like, whoa, I just kind of plugged them in, and they've been great.
Oh, that's
Really great.
fantastic. I love hearing that. Because there are things that I wouldn't think about because I don't necessarily work with that population. When you were saying a lot of them are very stiff and are fall risks, and then you get them to feel, for instance, their feet and feel like their feet support them. Do you find that they have emotional responses?
Um, they do. The most emotional responses are the patients with neuropathy. When
Hmm.
they get their sensation back, it's like, oh my gosh, I never
Mm.
thought I would feel my feet or the ground again.
Mm.
Um, the pelvis also, um, that part, there's responses to. Women that used to dance, that used to like to move,
Mm.
or their sexual energy, all of that is tied up in there.
Right, right.
So try to unblock that. But yeah, there are emotional responses for
And what do you
sure.
do when they come up? Do you just let it pass? Do you have any process? Do you have any protocols in terms of, um, you know, you refer them out? Because let me give
Mm-mm.
you an example. Like sometimes when
Mhm.
people come to me, they will kind of reveal some stuff. And if I feel like I should refer them to, let's say, a somatic psychotherapist, I will.
Mhm.
Because could be stuff that's unprocessed or stuff that is really I could see is really difficult for them and they haven't worked with it. I give them some
Right,
resources. Do
right.
you come across that, or is that just not the vibe of the clinic?
Well, we do, and I kind of dig around, because we see there are people that come for like months at a time, like, my shoulder, my shoulder. It's like there's nothing wrong with the shoulder, but they're obsessed with a certain body part.
Mhm.
So I know that it's unworked out problems. And we have tried to send them out. I've tried on my own. Sometimes people are just too blocked.
Mhm.
And other times they are open. They are quite open to they start to reveal more. They'll start to talk more of their emotional life. Not every therapist wants to go into that. Like I can, like I can do it. I'm not going to be their psychotherapist, but I can delve in there enough that we can look at that.
Hmm.
Yeah. Yeah. Yeah, like one of my patients, the one who loves that infinity sign, like her husband has Alzheimer's, he's been sick for many years, and she always talks about it. She's like, oh, those hips, like, oh, like our sex life used to be so good. Like
Mm.
it brings it back of like her loss of that that
Mm.
piece of her.
Yeah.
So, and I'm very aware of it.
Yeah, the whole concept of loss and grief is kind of when you get back in touch with your body, one experience through your body, one system in your body. There is a an emotional response, and a lot of times it is recognition of grief of what you've been missing, what you missed. It happens all the time. I see that a lot. Um,
Mhm.
and really what I see is like if they just have a moment to really process that real time and acknowledge that that's natural, that's what happens, that there's nothing strange about them or repressed about them, that it is just part of missing something. It's normal.
Mhm.
That
Mhm.
it can kind of flow through. Like, have you ever
Right.
seen those videos of people who get their hearing with a cochlear implant, or they get their color vision, and then when they get it,
Mm.
they start to weep a lot of times because it's a very emotional experience to recover something that you forgot about, or maybe you've never even had before. It's a deeply touching thing.
Mhm.
Yeah.
Mhm.
I imagine you must have that see that a lot when people, like you say, with the neuropathy, my feet, I feel my feet again, or dancers is like I can move again in a way that
Mhm.
I remember.
Exactly.
Yeah, yeah,
Exactly.
yeah.
Yeah. Yeah. I've seen it for myself personally. Like I wasn't that aware that I had, some of these different out of sync, you know, body issues. I was like sort of aware of it, but then with that grounding of the feet and what I was doing with your work, it's like, oh, like now I see. And I think it's made me a lot happier. Like I feel more secure with myself. I'm able to give more to them.
Interesting. Can you talk a little bit more about that? What does that mean? Like,
Um, it's like, I mean, I think a lot of us just, we go through life and all different, a lot of things happen to us and whatever. We don't really realize that we're knocked out of our bodies. Like I sort of I was aware of it, but I just kept pushing through. Like
mm,
many years, I would, like when I worked in the school system, I would walk into a classroom and everybody would turn around. I think, well, who are they looking at? I'm invisible. Like I'm not even here.
mm,
So like that, like sort of that disconnect. There was
mm,
definitely a disconnect. And I found when I worked in like therapy gyms, and I loved the swings, I loved all the proprioception, all the vestibular, like I needed lots of it, and it helped me. It made
mm,
me feel better.
mm,
So, but then I sort of, fell out of that. And then I recently bought a chair swing
mhm.
right after like working with your work, just just as kind of like my treat for myself,
Awesome. Yeah.
because I'm getting that connection.
Oh, yeah. Yeah. Finding more resources and creating more
Hmm.
opportunity for you to resource yourself.
Exactly.
Yeah, yeah, super cool. Yeah, I hear that all the time. People will say, I thought I was in my body, or I didn't know I wasn't in my body. And it's kind
Mm.
of hard to communicate the experience if you haven't had it. And that's why, when I first started kind of formulating this framework as a way to work with people online, it was really through the three keys, and it was more of a video course. But I wrote the book because I think people just needed to understand more. They were kind of like, how does this work, and why is this happening, and what does this mean? And So I wrote the
Mm-hmm.
book to give more context to what you're experiencing. And, at the core, what I'm offering is really a way just to organize your body so that you could feel more support, which is what you're feeling in your feet. You
Mm-hmm.
can feel your power without strain, which is really the theme of the Nautilus exercise. And you
Mm-hmm.
can feel your sense of, you can feel ease, and that's that elastic breath. And then when you bring them
Mm-hmm.
all together in the standing meditation experience, in the sensing posture, you can, organize yourself to be supported, grounded, so that you're available and you can listen from the depth of yourself. So that,
Exactly.
yeah, listen in a way that is fully present. And that's, I think, what people are feeling and they can't quite word is that there's this presence in their own home, in their body, that they weren't fully living.
I agree that the sensing posture is beautiful. Like that I've used a lot. I tell them it's like a reset. It's something you do in the morning to just get everything aligned with the breathing and feeling those feet into the ground. Especially one patient loves it. She has a brace on her foot because it's like a deformed foot basically, where it was never really on the ground, and now it's being corrected. So she'll do it in bare feet and she will just hug that floor, and it's been very good for her.
Yeah, that's
Yeah.
beautiful. That's beautiful. Yeah,
Yeah.
there's so much. One of the main reasons I'm doing this podcast is to help people understand what's possible. And there's so much within our human system that we're not getting the most out of. And one of them is the feet. And there's so many pressure receptors on the feet. And we can walk on our feet and still not use them very fully. It's a very complex um, structure. And that's why the shin ankles, just that simple concept, can really help you get more into your feet. And my whole goal was to simplify the body coordination in a way that is very accessible.
Right. Yeah, and I really appreciate the anatomy because it's important to know, like, what are the structures? How do they move? The
Yes.
pelvis, because I've learned a lot of anatomy, but I really never learned those things, those crucial things of how does it move? What is it doing?
Yeah,
Um,
exactly. Exactly. I went back when I was started studying all this stuff. I went back to like a community college and I took anatomy, physiology, chemistry, the stuff that I didn't take in college. And it just felt so not relevant to the living system. It was just book.
mhm,
So that's when I started to get into body work because I wanted to
mhm,
understand the living anatomy and tissue, but still in body work, what you learn is you learn muscles really some,
mhm.
but it's a body on the table. It's not a body moving.
Yes.
And so, the studies I've done in the osteopathic tradition, they're whole body and movement pattern. So that's been really, really helpful.
Mm,
But also
mm.
just doing all the
Yeah,
movements.
you bring, sure. It's very rich. I think what you're bringing is a very rich body of knowledge, and there's a lot there. It's very deep, and I think people can really, yeah, can really learn from it,
Great.
really use it.
Great. Are you
Yeah.
using any of the eye stuff? You're not in my full program. I use eyes a little bit more richly in the full online program, but
Uh,
outside of this, because there's a lot that you could do with the posture and balance when you're using your eyes.
yes, for sure. I'd be interested in more because yeah, vision is it's huge.
Yeah,
It's
it's a
huge.
big deal.
We try to,
Yeah,
oh
yeah.
yeah.
That was really fun talking to you, Amy. Thank you. And it's so fun to meet you in person.
It's wonderful to meet you.
So I'm going to, do you want to say what the clinic is?
Oh, sure. So it's called Steady Strides Fall Prevention and stroke rehabilitation.
Okay, so you work with stroke rehab too.
And our doctor is Dr. Levi Atanilov, and he is a Hopkins trained physiatrist. He started the fall prevention program at Hopkins, and then he decided to just make his own. And he has been working diligently. I was with him since it started. It's been about almost 7 years. And it's amazing what he's built.
Oh, that's cool.
Absolutely amazing. Yeah, and the website is Steady Strides, Steady Strides.
.com.
Yeah.
Thank you so much, Amy. I really appreciate your time.
Thank you, Sue. Thank you so much.
Bye-bye.